If you came here to treat your knee osteoarthritis before it gets too bad, you came to the right place. Hi, it's Daniel from Supply PT, where we help people get back in motion. If you are new here, please go ahead and click that subscribe button and all the links to everything we mentioned in the video, which you can find linked in the description box below. Now let's jump right into it. Knee osteoarthritis is a leading cause of knee replacements. Early intervention is crucial to prevent progression, and below are effective conservative treatment options to help manage symptoms and improve joint function. 1. Exercise therapy. Exercise is consistently recommended as a core treatment for knee OA. It has been proven effective for pain management and improving physical function. It's very important to do strengthening exercises for the quadriceps and hips. These exercises should be tailored to the individual's needs and pain levels. It's important to start with low-intensity exercises and gradually progress as tolerated. Always consult your doctor or physical therapist for guidance before starting out any exercise program. Quadriceps exercises. Straight legs raises, mini squats, leg press, and knee extensions are good for the quadriceps, hip exercises, sit to stand exercises, standing leg raises, bridging exercises, and lateral step-ups. Various other types of exercise are also beneficial, including aerobic exercises like walking and cycling, range of motion exercises, low-impact activities like swimming, balance training, mind and body exercises like Tai Chi and yoga. 2. Weight loss. Weight loss is valuable for all stages of knee OA, reduces pressure on the joint, helps with pain relief, improved function and mobility, decreases inflammation, may slow the progression of OA. 3. Physical therapy. A physical therapist can provide supervised exercise programs, manual therapy techniques, education on activity modification, advice on proper body mechanics. 4. Medications, and please remember to consult with your doctor before starting any medications. Common pharmacological options include acetaminophen, for example, Tylenol, non-steroidal anti-inflammatory drugs, OTC, NSAIDs, examples being ibuprofen like Advil or Motrin, or naproxen such as Aleve, topical NSAIDs, and capsaicin. 5. Intra-Articular Injections. Two main types are used: corticosteroid injections for short-term pain relief, hyaluronic acid injections to provide lubrication and cushioning in the joint. 6. Cold therapy or heat therapy. Benefits of cold therapy: helps reduce inflammation and swelling, especially in acute phases. Constricts blood vessels, which can help decrease pain and inflammation. Numbs the area, providing pain relief, particularly useful immediately after injury or during acute flare-ups. Benefits of heat therapy: promotes muscle relaxation and reduces stiffness, enhances blood circulation to the affected area, modulates nociceptors, helping with pain relief, increases tissue metabolism, and accelerates healing processes, improves range of motion by enhancing tissue extensibility, may promote an angiogenic environment and enhance muscle strength, can improve quality of life, pain, functional capacity, and general health perception in knee OA patients. Increases compliance with home exercise programs when applied before exercises. Conservative treatment for osteoarthritis is crucial. It's important to explore your options and collaborate with healthcare professionals to create the most effective treatment plan. Stay informed by subscribing to our channel, stay proactive in your care, and remember, at Supply PT, we're here to help you get back in motion.